All right, we have some breaking news now for you out of Kenya. Let's go to our reporter there, Sarah Kimani, and we understand that a leading politician has tested COVID-19 positive. Sarah, what's happening?
Yes, indeed. We've just received news from former Prime Minister of Kenya and opposition leader Raila Odinga's doctor that indeed Raila Odinga has tested positive for COVID-19. Now, Raila was admitted at the Nairobi hospital 2 days ago. That is on the 9th of this month. And we understand at the time doctors, when they took tests, they said that he just needed to take a break and that he was tired because he has been on the campaign trail because Kenya is about to go to a referendum on the new constitution. And Odinga is one of the main proponents of the change of the constitution. And he had come from the coast of Kenya. Now, incidentally, the coast is one of the hotspots for COVID-19, and it has been a hotspot. But a lot of people believed, because he's quite old, he's 76, that indeed he may be tired. However, it was a bit suspicious because the doctors, even at that time, said that he needed to isolate himself for 2 weeks. But now this evening, they have indeed confirmed that Mr. Odinga is suffering from COVID-19, and so he will remain in isolation. However, they say that he has mild symptoms.
All right, so I was going to ask you about his condition tonight, and you'll follow that for us. Is there any concern about him coming into contact with many people ahead of that referendum, other politicians?
Well, and that is a problem because although the president himself, when he last spoke to the nation about rules and regulations and protocols that the government had put in place, concerning COVID-19, one of the issues they said is that even though political meetings were going to go on, they would be done in town halls and they would only take about 150 people maximum. However, every politician who has held political rallies, including the president himself, Uhuru Kenyatta, has been having massive rallies, interacting with residents. In most of those rallies, and we will be running pictures in the programs that will follow, we have seen both the leaders and the residents not, adhering, not wearing masks, not keeping social distance. The meetings, like what Odinga held in Kwale County at the coast of Kenya, in Kilifi County at the coast of Kenya, in Mombasa County, none of those meetings adhered to those regulations. And so there was a lot of interaction, and we still do not know who he came into contact with or where he may have contracted the disease from. But it is clear now that he now joins the statistics of the 863 people who tested positive for COVID-19 in Kenya today.
All right, well, if Kenya is not taking those regulations seriously enough, I mean, Tanzania has been world famous for some denialism. Sarah Kimani, are you still there?
Yes, I'm still here. I can hear you.
All right. We just heard some beeping. But there are reports, I'd like you to comment on these, that the Tanzanian leader is in Kenya. Any veracity to that?
Incidentally, President Magufuli, we have been told, is in Kenya, in the same hospital that we understand now Prime Minister Raila Odinga is admitted in. Both of them used to be bosom buddies. Last time I interviewed Raila Odinga, which is about a year ago, he told me that they have fallen out with the President Magufuli, mainly over ideological issues over COVID-19. He said he tried reaching out to him over his sentiments, over, the denials of the existence of COVID-19. Here in Kenya, there is no denial, and they accept that there is COVID-19. What is happening is that everybody, including politicians and Kenyans themselves, have not been adhering. We will wait to hear what President Kenyatta says, because tomorrow he will be addressing the nation on the first year anniversary since the first case of COVID-19 was announced here in the country. So it will be interesting to hear what the president himself will say, whether he will say anything about former Prime Minister Raila Odinga, who incidentally is now his bosom buddy. On the day that Odinga was admitted to hospital, he was supposed to have a meeting with President Kenyatta, but we understand that meeting did not take place. It was to mark the third anniversary of what we call here the handshake, the agreement between the two political leaders which brought them together after a fiercely fought election between Odinga and President Kenyatta.
All right, very quickly, let's be explicit. Do we know what the Tanzanian President Magufuli is being treated for?
Well, we understand he's been treated for COVID-19 here in Kenya. There have been other reports saying that he has been evacuated to India. But due to the clamping of freedom of speech, freedom of the media in Tanzania, it is very difficult to even tell where he is. So mostly what we have been reporting, even ourselves, is speculation. Nobody knows exactly where President Magufuli is for sure, although reports in Kenya indicate that he's actually here in the country being treated for COVID-19 at the Nairobi Hospital, one of the main private and premier hospitals in the country.
But before you go, Sarah, that would be incredible if those reports are true. So a denialist who has probably prevented many of his own citizens of his own country accessing treatment and things like that because they're looking to their leader for cues, then would be going to a neighboring country to be treated for COVID-19 and accepting help from the health workers from a neighboring country.
Yes, indeed. An opposition leader who is in exile, Tundu Lissu, has actually indicated and said it would be hypocritical of President Magufuli, who has denied that there is COVID-19 and said that by divine intervention the country has been able to overcome COVID-19, and then he moves. Once he's unwell, he goes to seek treatment in a foreign country, while people in his own country are doing steam baths. He has told them time and again that they should, if they want to wear a face mask, then they should make their own face mask because the foreign ones are contaminated. Tanzania is the only country in the East African region, together with Burundi, that are yet to receive the COVAX vaccines because President Magufuli has said that these vaccines cannot be trusted. So quite ironical, and some people calling it quite hypocritical. And I'm sorry to say probably now embarrassing for him if indeed he has contracted COVID-19, probably why his government is not able to come out clear and speak about his whereabouts or even talk about his state of health like we have seen Kenya do with former Prime Minister Raila Odinga.
Yeah, that would be incredible if true. And Sarah Kimani is on the case for us in Kenya. Thank you very much reporting that breaking news. Raila Odinga, the opposition leader, has contracted COVID-19 but has mild symptoms at the moment. Of course, a lot of the speculation around where the Tanzanian president, who hasn't taken COVID-19 very seriously, is, and is he himself being treated for COVID-19?